We chose to look at treatment burden in early stage lung cancer patients as part of a project in our COPPER group at Yale, which is the Cancer Outcomes, Health Policy, and Effectiveness Research Center, because the United States Preventative Task Force came out with new screening guidelines for specific patients to undergo cancer screening for lung cancer. And we wanted to understand really the work of being a patient. And as oncologists, we see patients in clinic all the time, and a big part of what they tell us is that their job is undergoing cancer treatment or seeing doctors. And when you get a new diagnosis of cancer, patients are often expected to do many different types of things. And so we really wanted to understand what this meant to patients, because we're going to start seeing an increase in the number of early stage lung cancer diagnoses, and these patients are going to need curative treatment. So really with this question and seeing our patients every day, we decided we wanted to explore the concept of treatment burden. And to really delve into this issue, we decided to look at 8,000 Medicare patients in the SEER Medicare data set and really trying to determine how many encounters they had with the healthcare system during their early treatment. We found that on average, during their first year of treatment, whether they were receiving surgery or radiation, that on average a patient spent about 50 days interacting with the healthcare system. So this meant even with patients with early stage lung cancer, they were spending 1 in 7 days either getting the treatment itself, seeing a physician, or dealing with perhaps complications or hospitalizations due to the treatment to treat toxicities or other complications. So they were spending 1 in 7 days interacting with the healthcare system. Over 20 different doctors were involved in their care during this follow-up time, and they were prescribed over 12 different medications. So this is a lot for patients, and in particular among our older cancer patients, and they're really increasing in number in the United States. So this really was the first look at the work, understanding the work of being a cancer patient.